Hey guys, it's Paula Nutting, your musculoskeletal specialist, and I'm so proud to be able to introduce one of my patients or my clients, Wendy, and she's been to me twice, and this is our third visit.
It is.
Yeah. So Wendy came into me, I'm not going to say train wreck, but I'm going to say train wreck.
I was.
Yeah. So she'd fallen, had a huge fall and fracture of the upper part of the humerus.
That's right.
And a dislocation of the shoulder.
Yes, and it dislocated that humerus out as well.
Yeah. So how many months ago was that?
It was February, so we're almost at 6 months.
Yeah.
Almost 6 months. Yeah.
So about 6 months, she's had orthopedic surgical intervention, or not surgery, but they did a...
It was under the care of the surgeon. They had to put the joint back in, and I was under the care for him while I was they did that and recovered from that.
And has had physiotherapy and some great allied assistance to get her through the journey of that post-trauma. Has come to me through a wonderful guy, Sandy Clark. Shout out Sandy Clark, great chiropractor, but also functional neurologist, which is why we get on, because Wendy had really limited range in that shoulder, yeah?
Yeah, I did.
So can you tell us about the range? How was it?
Well, it was poor for me. I was very locked. I was doing everything that was requested of me from the allied health professionals, but I just was stuck and I couldn't get any further. And to me, it wasn't so much I couldn't feel pain, but I was very stuck. So I couldn't get my arm up quickly. When I did, I was fatigued quite easily. So that's where I was at.
Yeah. So Wendy came in to see me. The first thing we did is we actually worked on the neurolymphatic system. So we worked through to stimulate and make effective change on the diaphragm, because really when you think about a fall, we look at all of the injury and insult that happens as part of that. So thoracic mobility, extension and flexion. We looked at the shoulder range. What I did notice is that we had a massive disconnect with the diaphragm, inability to really take good breath.
I felt like it had been at least 5 months since I'd had a proper breath, until I saw Paula.
Until we done the magic of Chapman's reflexes. So really stiffened movement. First day we did a lot of Chapman stuff and a lot of myofascial work, so some glides and some positional release techniques, and talked about the whole concept of letting the mind assist with that movement pattern. I gave you some homework.
Yes, he did.
Bit of breathing, bit of tapping.
Yes, and I did it.
And then came back the next time, which was...
a week later.
Yeah, a week later.
It was a week later.
Yeah. How'd you feel then?
Well, a massive improvement just in the case of a week. The first couple of days I'd felt quite sore and tender. That was to be expected, and Paula had also, thank you, sent me an email to check in on me. But by the time the week and I'd sort of progressed through and continued with my homework, I felt just even so much more unstuck, and the ability for my arm to go up in front and off to the side, which was so limited prior to that, was just even in that week dramatically improved.
And then we re-facilitated work through there the second visit. These have only been 45-minute sessions, which has been pretty cool, only because we had to squeeze Madame in. So we did more thoracic stuff, and then we also had a look at the hip flexors and the glutes and what was happening in her pelvic stability, and gave a few little exercises. How did we go during that session?
Yeah, that was quite that was intense at times. You know, they were hurting, but even through just that one session, we definitely got some improvement through there. So that loosened up. I felt very tight all down through my hips, and that loosened all of that up greatly for me.
And now, what have we got with the arm?
The arm, we can now push up from the arm.
So how many push-ups did we do when she's not supposed to be doing any? How many push-ups did we do?
15. I know, I'm so happy. Sorry.
It's on the toe push-ups, everyone. Yes.
So proud of that one.
Yeah, exactly.
Yeah, thank you.
Yeah, that's all right. She's so cool. She's working really hard. So, guys, we're going to keep on this journey to make sure that we get some wellness, because the pelvis has still got some instability, and it's not just 2 shots. We do have to keep a mind's eye to make sure that she has strong homework. How long did the homework take?
A couple of minutes.
Yeah.
yeah, it's nothing. It's very achievable.
Yeah, because she's also doing a master's in nursing and also has kids and all that, so has to do about a million other things. So yeah, there's a bit on Wendy's plate. Don't forget that if you want to be a therapist who can do this kind of work and assist your clients, this is the whole reason I am doing this, is actually to get people to look after people like you.
Thanks, Paula.
I want this around the world. You guys, if you want to get some information, just click down on the links that I'll put below about the courses that are running in Australia. And Perfect World, we've got some happening in America next year, and I think possibly South Africa, but I'll be able to give you some more heads up on that later. See everybody, Paula Nutting, your musculoskeletal specialist. Wendy, my musculoskeletal paramour. Bye.